So we're just trying to discuss and understanding the concept of what autosomal recessive disorder. If you say that what an inherited genetic condition was actually autosomal recessive, what does it mean? And it's actually very simple. But let me tell you guys something. I was asked this in class when I started my year 4 of medical school and I wasn't able to answer this. Okay. So I don't take simple concepts for granted because there might be somebody out there actually having a tough time getting this done. So, in summary, autosomal recessive, that means what? For a child to have it, one of the parents must be a carrier. Sorry, not one. Both of the parents must be carriers. Okay, so this joining to this will now result to what? This. Do you understand? So autosomal recessive. It is recessive. For it to become dominant, it must be in both parents. Okay, so let's have it. We say that these autosomal recessive disorders make up the largest categories of what Mendelian disorders. These disorders will result only when both alleles at a given gene loci are mutated. Alright, so such disorders are characterized by the following features. The trait does not usually affect the parents. The parents are just carriers. So none of the parents actually has it. Okay, so it does not affect the parents of the affected individual, but the children might show the disease or the siblings might show the disease. Okay, siblings have one chance in 4 of having the trait. Right, unaffected, 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 but there's a one chance. All right, so one chance out of 4. So the reoccurrence risk is about what? If you have 4, if you say this is 100%, 100 divided by 4 is 25, right? So one chance is basically what? 25%. Every time you are giving birth, there's a 25% chance that that baby will have the disease. So now, if the mutant gene occurs with a low frequency in the population, there's a strong likelihood that the affected individual proband is a product of the what? Consanguineous marriage. The following features generally apply to most autosomal recessive disorders and actually distinguish them from autosomal dominant disease. You know the autosomal dominant, that one, even if it is just one of your parents that have it, you have it. Do you understand? That one is much more risky than the autosomal recessive. So now the characteristics of these autosomal recessive disorders include expression of the defect tends to be more uniform than in autosomal dominant disorders. Right? It's more uniform. The complete penetrance is common. Onset is frequently. If a child has this, that means what? The child generally just inherited a mutated gene. Okay? The full mutated gene, half from the dad, half from the mom. So it will manifest early in life. Although new mutations associated with recessive disorders do occur, they are rarely detected clinically. Since the individual with a new mutation is an asymptomatic heterozygote, several generations may pass before the descendants of such a person mates with other heterozygote and produce the affected offspring. Just simply tell you that what that is heterozygote, it's not homozygote. Okay, so if he inherited this, he might keep passing heterozygote traits. He might keep passing heterozygote traits without the children being affected. See, these children get to meet other people that are also heterozygote. Then they now give birth to a homozygote child. You understand? So many of the mutated genes encode enzymes in heterozygotes. Equal amounts of normal and defective enzymes are synthesized. All right. Usually, the natural margin of safety ensures that cells with what have the usual complement of enzymes that actually function normally. All right. Autosomal recessive disorders include almost all the inborn errors of metabolism, which we'll be talking about. So these are examples of what autosomal recessive disorders, and let's go through it. Disease condition affecting metabolism. We have cystic fibrosis, phenylketonuria, galactosemia, homocystinuria, lysosomal storage diseases, antitrypsin deficiency, Wilson's disease, hemochromatosis. We have the glycogen storage disease. Then diseases affecting what? Blood production. We have things like sickle cell anemia, thalassemias. Diseases affecting the endocrine system. We have congenital adrenal hyperplasia. Diseases affecting the skeletal system. We have the Ehlers-Danlos syndrome. Then we have Phenylketonuria. Then disease affecting the nervous system, we have the neurogenic muscular atrophies, we have the Friedreich ataxia, we have the spinal muscular atrophy. Okay, so that's it, guys, about what understanding the concept of what autosomal recessive disorders. See you guys pretty soon.